This conference will now be recorded.
Good morning, students. Thank you once again for coming to today's microbiology online class. Today we are going to learn about herpesviruses. So, have you seen this? Fever blisters, cold sores. So many of us, when we have fever, we may develop blisters on our lips. Have you seen these? Next, the child with multiple blisters covering the body with chickenpox. Have you heard about chickenpox? Yes, we all have heard about chickenpox. We all know about cold sores. Both the infections are caused by herpesviruses. Okay, so we are going to learn now about herpesvirus. Herpesviridae. What are these? Herpesviridae are a large family of DNA viruses that cause diseases in animals, including man. So what are Herpesviridae family? This family consists of about DNA viruses, and they are able to cause disease in both man as well as animals. The family name, it is derived from a Greek word herpein, means to creep, referring to the latent reoccurring infection typical of the group of viruses. And this family cause latent infections. Okay. The virus belonging to the family and the name herpes is usually derived from Greek word herpein, means to creep, because they are responsible for causing latent and reoccurring infection. They again and again they may cause infection. That's why they have been derived name herpes. Some general characteristics of Herpesviridae family. What are the common characteristics? First one, they can develop a latent stage. Means they can develop a latent stage. The virus may usually remain hidden in our body for a long period of time, and later it may cause infection again. This is one of the general features of viruses belong to Herpesviridae family. Second one, the members in the subfamily, that is alpha, have a cytopathic effect on cells, which become multinucleated chain syncytial cells with intranuclear inclusion bodies. Now, in Herpesviridae family only, they are further divided into different groups, such as alpha, beta, and gamma. Okay? In this family, the viruses which are present in alpha group usually have a certain pathogenic effect on the cells when they grow. That is called as cytopathic effects. We have learned about cytopathic effects. Yes, general properties of viruses. What are cytopathic effects? When a virus grows in the cell, it may change the cell structure. Okay? Those changing of a cell structure is called as a cytopathic effect. The cell may become round, or all together they may group together, or they may be crenated. So these are all types of cytopathic effects. In the case of alpha group, this results in the formation of multinucleated chain syncytial cells. What do you mean by multinucleated chain syncytial cells? Syncytium means all of the cells come together and they form a group, resulting in the formation of a large giant cell. This is called as multinucleated giant syncytials. Majority of herpesvirus infections are held at bay by cell-mediated immune response of our body. Next, what do you mean by latency? What is latency? During primary infection, the viruses migrate up the nerves to the sensory ganglia and reside there. The viruses rest there until reactivation occurs, and maybe later, due to some stress such as menstruation, anxiety, fever, or exposure to heat due to sunlight, as well as due to weakening of the cell-mediated immunity, these viruses may reactivate. During reactivation, the latent virus will migrate out of the peripheral skin through the nerves to cause local destruction. This is how latency takes place in herpesvirus diseases. Latent means what? They usually remain hidden. Example, the viruses usually remain hidden. They become silent, sleepy. They don't cause any effect. In the later stage, when your cell-mediated immunity decreases, or due to some stress or anxiety, what will happen? These viruses may awake again. They migrate out of the peripheral nerves to the nerves to cause destruction of that area. Herpesviruses, most important human pathogen and wide host cell range, and they usually cause lifelong infection. Periodic reactivation is common and usually consists of about large number of genes. However, some viruses are susceptible to treatment. Classification of herpesvirus is very important for you. All of you, please write this entry. Okay, so herpesviruses are classified into three main types: alpha, beta, and gamma. Alpha group consists of about herpes simplex virus, type 1 and 2, and varicella zoster virus. Gamma, Epstein-Barr virus. Beta, cytomegalovirus, human lymphotropic virus, and BK virus. Okay, so altogether three are there: alpha, beta, and gamma. Alpha consists of about herpes simplex virus, type 1, type 2, and varicella zoster virus. Gamma consists of Epstein-Barr virus, and beta, cytomegalovirus, human lymphotropic virus, and BK virus. Morphology. The capsid is icosahedral and composed of about 162 capsomers enclosing the capsid. Okay, so can you see this? The capsid inside this icosahedral shape. Okay, and it is usually enclosed within the core. Core contains double-stranded DNA. So the genetic material is double-stranded DNA. Next, nucleocapsid is surrounded by lipid envelope, which is derived from a host cell membrane. Okay, next, nucleocapsid is surrounded by lipid envelope. This nucleocapsid is usually surrounded by an envelope. What's the nature of the envelope? Lipid. From where is the envelope derived? The envelope is derived from host cell membrane during budding, when it usually comes out. After forming daughter virus cells, these newly formed virus cells, when they come out of the infected cell from the host cell membrane, they acquire the envelope. And the envelope is lipid in nature. On the surface of the envelopes, spikes are present, which are about 8 mm long. Tegument. Tegument is an amorphous structure which is present between the envelope and capsid, containing several proteins. Okay, so envelope. This envelope consists on the surface spikes. Diagrammatic structure of herpes virus. So what is this inside? Can you see DNA? Yes, DNA is present. The DNA is double-stranded. And next one is what? Yes, nucleocapsid is there. Next, envelope. Envelope is lipid in nature. Next, on the surface, spikes are there. Next, infectious caused by a herpes simplex virus. How many types of herpes simplex virus are there? Two main types. Herpes simplex 1 and herpes simplex 2. Herpes simplex viruses. Herpes simplex viruses are spherical in shape, consisting of genome, double-stranded DNA. Human herpes virus 1 and 2. These human herpes virus 1 and 2 are neurotropic and neuroinvasive viruses, and they usually enter and hide in the human nervous system, accounting for their durability in human body. Okay. Herpes 1 is commonly associated with herpes outbreaks of the face known as cold sores or fever blisters. So, fever blisters, you know now, where do you get fever blisters? On the face. So, on the face, if blisters occur, then it is caused by herpes simplex virus 1. Whereas herpes simplex virus 2 causes lesions on the genital area. Therefore, herpes simplex virus 2 is commonly known as genital herpes. Next, generally HSV1 causes infection above the belt, whereas HSV2 causes infection below the belt. Means what? Herpes virus 1 usually causes infection on the upper part of the body, face, arms, like this, whereas HSV2 causes on the genital area. Herpes simplex virus is spread by contact, as the virus is shed in saliva, tears, genital, and other secretions. As far the most common form of infection results from a kiss given to a child or adult from a person shedding virus. Primary infection is usually subclinical in most individuals. It is a disease mainly of young children, that is, brutal below 5 years. So what is this? Herpes simplex virus. Usually two types are there, 1 and 2. One causes infections on the upper part of the body, whereas two causes infection on the lower part of the body. A person can acquire infection caused by herpesviruses by coming into contact with infected saliva, tears, genital secretions, or other secretions. Most commonly, it is usually spread by kiss. Okay. Primary infections are usually subclinical in most persons, and herpes infections are commonly seen in young children who are below 5 years old. Infections in humans. Widespread in humans, broad host ranges, and they usually replicate in many types of cells and produce cytopathic effect. Most common diseases are gingival stomatitis and keratoconjunctivitis, encephalitis, and genital diseases. Newborn infections, latent infections in the nurses. Pathogens. They cause catalytic effects and infect skin and the mucous membrane. The type of inclusion bodies that can be seen is cowdy, cow-dry type A inclusion bodies. Cytopathogenic effect is multinucleated chain cells. Pathogens. Now we will learn how pathogens exist. So how does man acquire infection? By contact with contaminated saliva. Okay, next, tears, dental secretions, etc. So how? Pathogenesis occurs. The virus entry by skin or mucous membrane, and they multiply. Multiplication of the virus inside the cells of the body causes lysis of cells, which leads to the formation of vesicles and finally ulcers. Sometimes, when the virus is multiplying, some of the virus may enter the sensory nerves. From sensory nerve, they enter into the root ganglia and they reside there latent. They usually latent. These viruses, during the later life, what will happen? They will reactivate, causing again treatment. Next one. Source of infection, saliva and skin lesions. Next. Predisposition of latent infection. What is this? Predisposition of latent infection. Two types of herpes simplex virus are there, 1 and 2. Therefore, the route of where they usually remain latent will also differ. In the case of herpes simplex 1, trigeminal ganglia is the place where they reside. Whereas in the case of herpes simplex 2, sacral ganglia. Immunity is cell-mediated immunity. Predisposing factor, axonal injury, physical, emotional stress, and UV light. About 80% of the adults harbor antibodies to herpes simplex viruses. These are frequent blisters in herpes simplex. Herpes lesions in the oral cavity. And gingival stomatitis. Have you seen this one? Gingival stomatitis? Yes. So many of you may be having. Okay, it is a painful swollen gums, mucous membrane with multiple vesicles. Fever and systemic symptoms can accompany the infection, and the disease will resolve in about 2 weeks. And vesicles can also appear on areas of the skin where viral entry has gingival stomatitis. Okay, can you see that? Inside the gums. See how are the lesions? Whitey. You can see such type of lesions also due to vitamin deficiency. Genital herpes. Despite common low, genital herpes may be caused by both, either one or two. It is usually characterized by fever, headache, vaginal or urethral discharge. The lymph nodes are enlarged, followed by blisters and ulcers. Ulcers may be either painful or painless. Hepatic keratitis. Hepatic keratitis is the common cause of corneal blindness in the United States. Next, neonatal herpes. What is neonatal herpes? Herpes simplex virus infection during pregnancy can result in transplacental viral transfer. The infection of the fetus can cause congenital defects or intrauterine death. The neonate can also acquire the illness during delivery if the mother is having an active genital infection. So what is this neonatal herpes? If the mother is usually infected during pregnancy, then while she's giving birth to the baby can also acquire infection. Hepatic whitlow. See the finger, see the nail, how it is. This is infection of nail. How is the finger? It is red and it is swollen, right? And it will also be painful. This hepatic whitlow used to be a common infection in healthcare workers before gloves have been discovered. Disseminated herpes. This is common in immunocompromised patients, such as patients who have undergone organ transplantation or cancer chemotherapy or malnutrition, etc. Encephalitis. Infection of brain cells, which ultimately leads to cell death and brain tissue swelling. Patients usually present with sudden onset of fever and focal neurological abnormalities. HSV1 must always be considered because herpes is one of the few treatable causes of virus encephalitis. Next, herpes is also one of the member of TORCH, very dangerous diseases. What are TORCH? TORCH means toxoplasmosis, rubella, cytomegalovirus, herpes HIV, and syphilis. Next, you have known that there are two types of herpes virus simplex. Now, what are the major differences between these two? First, herpes virus 1 usually causes larger pox when you inoculate on chorioretinitis membrane of chick's embryo. And they usually replicate well, and they are more neurovirulent. Okay, next, type 2 strains are more antiviral resistant. and restriction under nucleases analysis is usually used to treat, whereas HSV2 monoclonal differentiation. Next, they are usually smaller when compared to the formation of pox. Okay, HSV1 usually forms large pox, whereas HSV2, the size of the pox will be smaller when compared to HSV1. Next, they replicate well on thick embryonated fibroblasts, HS1 can replicate, whereas HSV2, they cannot replicate well on thick embryo fibroblasts. HSV1 are more neurovirulent, where 2 is less neurovirulent. Next, type 2 strains are more antiviral resistant, whereas HSV2 are less antiviral resistant. Next one. Lab diagnosis. What is the laboratory diagnosis of herpes simplex viruses? Microscopy, antigen detection, and DNA detection by PCR, viral isolation, and serology. First one, microscopy. For microscopy, you usually do Zang smear. It is the specialized type of smear that we employ for the detection of herpes. Next one, to look for the presence of intranuclear inclusion body, that is cow dry type A inclusion body. Next, electron microscopy and fluorescent antibody technique. Next, specimen. What is the specimen that you cut? Saliva, cerebrospinal fluid, and vesical fluid. Next, virus isolation. How will you isolate the viruses? These are usually cell lines. Viruses are usually isolated in chick embryo and tissue cultures. The tissue cultures that we employ is primary, embryonic, kidney, human, and beyond. Next one. Treatment. How will you treat herpes simplex viruses? Hydroxyuridine is commonly used as an eye and skin ointment for infection, whereas for systemic, acyclovir and vidarabine are usually used. Yes, so keep in mind the treatment, the drugs which are given is acyclovir and vidarabine, whereas for eye infection and skin infection, for ointment, you can use it as hydroxyuridine drops. Next, we have learned about alpha viruses. We are learning already two over. What are they? Herpes simplex virus 1, herpes simplex virus 2. Next one is varicella zoster virus. Varicella zoster virus. What is this varicella zoster virus? Chickenpox. One theory is that the blisters that are seen during illness. In chickenpox, you see blisters? Yes, you can see blisters. Then why are we calling it as chickenpox? Why are we using the name as chicken here? The name chickenpox because the blisters that appear seems like the skin that has been pecked by a chicken. Okay, did you understand? If a hen pokes you on the skin, how the lesions appear? Reddish, poking like. That is why these lesions are usually termed as chickenpox. As the name implies, the viruses cause two types of diseases. See the name virus. Varicella zoster virus. So two, varicella and zoster. Two will be there. Varicella means chicken pox. Zoster means shingle. Keep in brain, chicken pox. The name is pox. It does not mean that it is caused by pox viruses. Chicken pox is caused by herpes virus. Okay? Varicella is usually a disease of children. After resolution, the virus remains latent as described previously, and in later life, they reactivate to cause second disease called as zoster. Now, varicella zoster virus. Varicella, that is chickenpox, is usually a disease of children. Mainly, chickenpox occurs in children. Okay, sometimes what will happen? The virus, after entering into the body, they may remain back. A common feature characteristic of herpesviruses are latency. So in the case of this one also, the virus may become latent and later they may reactivate. When they reactivate, then it is not called as varicella, but it is called as zoster. Once again, with stresses and depressed cell-mediated immunity, the virus will migrate out along the sensory part and cause vesicles similar to that of chickenpox. However, with this reactivation infection, the vesicle appear in the dermatome distribution, always mostly unilateral. Varicella. Varicella is a DNA virus which causes chickenpox. It is a contagious disease, mainly in children, characterized by generalized vesicular eruptions on skin and mucous membrane, severe manifestations in adults and immunocompromised. Varicella zoster virus is highly contagious. So it is a highly contagious infection. And it occurs in epidemics. Next one, mode of transmission. How does a person get infected with varicella? Airborne droplets and direct contact with varicella patient or vesicular fluid or zoster patient can be the source of varicella in susceptible children. Next, pathogens. So how does the virus enter? Okay, airborne, so respiratory tract. The virus enters to respiratory tract and later spreads to the lymphatic system. After that, it replicates in the respiratory epithelium and reaches the blood, infects macrophages and monocytes, and replicates again to cause viremia. So what does this happen? Man acquires infection through droplets inhalation, respiratory tract, right? Then after entering through our respiratory tract, they spread through lymphatic system. And they replicate in the respiratory epithelium. After replicating in the respiratory epithelium, they enter into the bloodstream. Presence of virus in the blood causes viremia. Okay. During this stage, both macrophages as well as monocytes are infected. Appearance of a characteristic. Next, what will happen? Appearance of characteristic vesicular rash containing multinucleated germ cells with intranuclear mutations. After an incubation period of about 14 days, the virus arrives at the main site, the skin. Where do the lesions appear? On the skin, right? So what will happen? After infecting the blood and causing primary viremia, rashes appear after 14 days. Following primary infection, the virus usually remains latent in the cerebral or posterior root ganglia. The virus reactivates in the ganglia later in life to produce rash in the dermatome or along the dermatome. What do you mean by dermatome? Wherever the nerves are present. See, in the first one, varicella usually causes rashes anywhere out of the body, but not along the dermatome. Whereas this is shingles, rashes are mainly caused in the distribution of the dermatome. So wherever nerves are there, that pathway rash will be caused. As a result, those nerves are also infected. So there will be nerve pain in the case of reactivation, that is shingles. Chickenpox. Chickenpox is a primary infection with varicella zoster virus. Incubation period 14 to 21 days. It is characterized by fever, lymphadenopathy, headache, followed by rash. The rash starts on the face and trunk, spreading to the entire body, including mucous membrane. Next, vesicle. The skin vesicles that form are described as a dew on a rose petal, a red base with a fluid-filled vesicle on top. Can you see this vesicle? How it is? They are like the dew drops, water drops, right? So the down will be erythematous reddish, and the drop vesicle is usually filled with pus. The person is contagious 1 to 2 days before the rash appears until all the blisters have formed scabs. This dew drops on the rose petal, and that left side, say, chickenpox vesicles. Clinical features. How does the eruption start? The eruption first starts as a macule. So first to develop is a macule. Then within 24 hours, the macule changes into vesicle, right? First it starts into a macule. It is not filled with any pus. After 24 hours, it is filled with fluid. Then it is called as a vesicle. This fluid becomes pustular, pus forming. Next, the fluid becomes cloudy and the vesicle ruptures and the lesion scabs open. Multiple vesicles arise in patches and the crop will form as another crop scabs over. Therefore, there are lesions in different stages. The vesicles all scabs usually disappear within 1 week, and the patient then ceases to be contagious. See this diagram? Vesicle becomes cloudy and distressed in the center, and it is usually umbilicated. Next, what is happening? It is becoming dry, right? The crust is formed in the center. Next one. Rash begins on the trunk and spreads to the face and extremities. So chickenpox, the rash first appears on the trunk and then the face and extremities. Next, chickenpox during pregnancy. Chickenpox in pregnancy is dangerous to the mother and baby. It is more severe if the mother has acquired chickenpox during first half of the pregnancy. If the mother acquires chickenpox during the first 3 months, then it is very dangerous. Okay, what is this? Early half of the pregnancy. Fetal varicella syndrome is cicatrising, lesions, hypoplasia of limbs, and chorioretinitis and central nervous system defects. Whereas in later pregnancy, it usually leads to pneumonia and encephalitis. More common if acquired, if less than week before delivery. So what is this? If a mother acquires chickenpox during the first 3 months of pregnancy, then the complications are very severe. The child may develop central nervous system defects, as well as there is hypoplasia of limbs, as well as chorioretinitis. Later half means they may develop pneumonia and encephalitis. Treatment. What is the treatment for chickenpox? Acyclovir. Keep in brain, acyclovir. What is the treatment for herpes simplex virus? For herpes simplex virus, you can use it. Even for chickenpox also, you can use acyclovir. Vaccine. Live attenuated varicella vaccine. That is Orca strain given subcutaneously. 2 doses, 12 to 15 months, and later 4 to 6 weeks. Another one is there, modified lyophilized vaccine. This type of vaccine is safe and effective and given to children with 1 to 12 years. Single dose. Whereas for older adults, 2 doses, subcutaneous. Okay, so that is chickenpox. Now, what will happen if the virus reactivates? It will lead to zoster. So, chickenpox is a disease of childhood, whereas zoster is a disease of old age, which is mainly due to reactivation in patients who had chickenpox years earlier. Zoster, shingles. This zoster or shingles usually follows a stressed state or lower cell-mediated immunity, and the latent virus, which is usually present in the sensory ganglia, they replicate and they migrate to the peripheral nerves. Symptoms: burning, painful skin lesions develop over the area which is supplied by sensory nerves. The diagnosis of zoster is likely when the patient develops a painful skin rash that has developed along the dermatome. See this. This is a zoster. Can you see how it is? Can you differentiate between chickenpox? Right. Chickenpox individual. See this one, how is zoster? They are spreading like. Since zoster, it is the same virus that chickenpox. Children and adults who have never contracted varicella can get chickenpox from exposure of victims. Means what? Shingles or zoster is caused by varicella zoster virus, right? So okay, one healthy person is there. He has never contacted chickenpox. If he comes into contact with a zoster patient, he may acquire chickenpox only, but not zoster. Clinical features. What are the clinical features? Erythematous, maculopapular, vesicular lesions. And lesions in clusters rather than scattering. Most important manifestation of shingles is pain. Clinical variants. What are the different clinical types of herpes zoster or shingles? First one, zoster sine herpesviridae. It is an acute segmental neuralgia without overdeveloping of cutaneous eruption. So what is here? There is no cutaneous eruption here, but there is segmental neuralgia. Next one, Ramsay-Hunt syndrome. Here there is involvement of facial and auditory nerve. Next one, zoster ophthalmicus. Ophthalmicus means the ophthalmic division of the fifth cranial nerve is involved. Let's see this one. So what is this? Ramsay-Hunt syndrome. So Ramsay-Hunt syndrome. Okay, next one, lab diagnosis. So what's the lab diagnosis question? Specimens. How will you collect the specimen? By extracting from the fluids from vesicles. Next one is microscopic examination. See for the presence of multinucleated chain cells and also see for the presence of inclusion body. What type of inclusion bodies are present? Cow-derived type A inclusion bodies. Next one, virus isolation. How will you identify the virus? Virus may be isolated from human fibroblast virus cells, as well as to see the presence of syncytium formation. Next, zoster prevention. How will you prevent zoster or shakes? Preventive measures should be considered for individual and risk of contracting severe varicella infection. Okay, and you can prevent by giving zoster immunoglobulin. Antiviral agents can be used in acute phase, and oral steroids can also be used. Next, what is this about varicella zoster? What does varicella cause? Chickenpox. How can you differentiate from smallpox? How can you differentiate chickenpox and smallpox? Chickenpox, superficial lesions. Smallpox, deep hard lesions. Chickenpox, lesions not umbilicated. They are usually of dewdrop appearance. Whereas smallpox, lesions are umbilicated, and the lesions in the center, they are usually there is depression. Next, chickenpox, lesions more likely on the trunk, whereas smallpox on the extremities. Chickenpox, different stages of lesions may be present, whereas in smallpox, lesions of the same stage of development are. Okay. Thank you. That's all for now. In your next class, you're going to be learning about herpesviruses, beta and gamma. Okay. Thank you.
This conference will now be recorded.